For people with suspected sleep apnea, for example, then they will be scheduled to something is called a sleep study, and the medical term for that is polysomnography. So you might see that on the referral form that the patient is scheduled for polysomnography study, which means the patient will come in to spend the night in one of our sleep centers, either here or at the Millennium, or sometimes they go to other center in Easley. And the patient will be monitored throughout the night. They spend exactly the same way they sleep at home. We allow them to watch TV if they like to, if they want to read before they go to sleep. We try to simulate the same thing how they sleep at home.
Sleep study basically has a number of parts, and I kind of reiterated like the little things that we're looking for. So we're going to put a lot of probes onto people. Okay, so if you expect to only get like 1 or 2 lines on you, you'll be in for a rude awakening. There's a lot of probes. There's about, I think, about 20 probes they put on your head, because that helps us determine what kind of sleep you get. We also have sensors to see if you're snoring. We have sensors to see if you're moving your legs, how your belly is moving, how's your abdomen moving, and that kind of gives us a lot of ideas of what we call these things of like hypopneas or apneas. We also see how your heart's beating, because a lot of times during the night when people are having more of these episodes, what happens is that their heart beats regularly. And if it does, that is also not good for you, because some of these episodes of sudden death have been related to irregular heartbeats. So now in terms of videotaping, videotaping is variable. For a lot of the stuff we do watch it because we need to see what you're doing at nighttime. Some people have these things which we call Rem Behavior Disorder. So a certain part of their sleep when they're dreaming, normally our body is pretty protective. It makes us not move our muscles so we don't hurt ourselves or our partners or our loved ones. But at nighttime, people can move around and act out their dreams, and as a result may cause some trauma to themselves or their loved ones. So videotaping is important for that. It's also protective for the patient, because technically the patient will know that, hey, nobody else was in my room, because you know, they have it on camera.
The next day, the scoring tech at that point will review that, and they will have the report ready for the physician to do their interpretation. And from there, then the patient will be contacted again after that to schedule an appointment to come back to either have a second night if we suspected they have a sleep apnea in the first study. Then they will come back for another night to do what we call like a Cpap titration, where they try the Cpap machine and we determine what the best level of the pressure they will need. So after all these tests are done, the patient is contacted again to come back and see the provider they have seen initially or another provider to determine what the best option, go over the test result, and determine if they're comfortable with starting that treatment plan or not, and then the treatment will be initiated and further follow-up will be scheduled.